Health Info, bringing you well-researched medical information. Today we will share some views on type 2 diabetes and expert discussions on whether the disease should be managed through lifestyle intervention or medicines. The discussion took place in the Diabetes Congress in Berlin, Germany in 2022. Type 2 diabetes is a condition where the pancreas is unable to produce enough insulin to help metabolize glucose or produces a poor quality of insulin, which doesn't get the job done. Over the years, discussions have centered around what methods can help manage diabetes. However, there is still no cure for the condition. Here are some key highlights and discussion points that took place around diabetes type 2 at the Congress. Diets promote remission. According to a group of diabetologists, lifestyle interventions, which refer to measures to change habits that lead to healthier living, remain a cornerstone to managing type 2 diabetes. Examples of such interventions include low-calorie meal replacements, liquid meals, etc. The results of the direct trial have demonstrated a significant reduction in weight by over 15 kilograms and signs of clinical remission. Clinical remission is the A1C value, which is a blood component tested in blood to check for level of sugar control. In this study, participants were able to achieve A1C levels of less than 6.5% after 12 months without taking anti-diabetic medication. The sustained remissions were observed even after 24 months for more than a third of people who took part in this trial. This sustained remission was linked to the extent of sustained weight loss. Newly diagnosed patients are likely to achieve remission. It was found in the direct trial that 86% of those patients who lost at least 15 kg went on to achieve remission. This was because at this point the body begins to release postprandial or after-meal insulin within 8 weeks. Beta cells need space. In livers where fat storage becomes high, the beta cells, which are responsible for producing insulin in pancreas, get displaced, broken, or enter a state of hibernation, since fat starts depositing in the pancreas. Diets that help reduce fat from liver are thought to also reduce fat from pancreas, thus waking up the beta cells to start working again. Individual fat threshold. Each person is different, or so type 2 diabetes has come to show. Every individual has a unique fat threshold. If an overweight person falls below that fat threshold, they start achieving clinical remission. A study in Canada conducted in pharmacies replaced reduced carbohydrate diets with low-calorie meal replacement, which led to 35% of patients discontinuing their diabetes medication after 1 year. Not everyone, however, agrees that lifestyle changes are enough to manage type 2 diabetes. Some arguments posited at the Congress are as follows. Cardiovascular changes happen early. Type 2 diabetes is not just about having a high sugar content, but it brings about cardiovascular renal disease. CRD can happen even before the patient starts showing high blood sugar levels. According to Aronson and Rayfield, both type 1 and type 2 diabetes are powerful and independent risk factors for coronary artery disease or CAD, stroke, and peripheral arterial disease. Atherosclerosis accounts for virtually 80% of all deaths among diabetic patients. Preventing cardiovascular events. Diabetologists state that patients with type 2 diabetes are at risk of experiencing cardiovascular event. Therefore, it is important to manage and prevent any damage to the heart and kidneys. New meds are here. New meds such as SGLT2 inhibitors and GLP-1 receptor agonists have been found to reduce serious cardiovascular events. Diabetologists, therefore, believe that these drugs should be added in patients' medication list due to strong clinical trial evidence of their efficacy. Soft parameters. Experts argue why only heart attack prevention and prolonging survival are the only concerns. Soft parameters such as avoiding knee operations, improving quality of life, or conditions that affect the immediate future should also be considered. So there you have it. A small glimpse into the important discussions that took place related to diabetes and related medical conditions at the Diabetes Congress 2022. We hope it provided you with some up-to-date information about the treatments that are being developed for patients who suffer from diabetes. We thank the researchers and physicians who are engaged in this important work to help make the lives of patients better. Keep watching our videos to learn more about new developments in diabetes. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.